Over 60. 4 dangerous vitamins you should never touch, and for you must take daily senior health tips. A 78-year-old woman from Michigan ended up in the emergency room last month after taking what she thought were harmless iron supplements for 3 months. Her family had no idea that these supposedly healthy vitamins were slowly damaging her heart and liver. Doctors found dangerous levels of iron in her blood, causing organ stress that could have been fatal. This isn't an isolated case. Medical professionals across the country are seeing more seniors hospitalized because they're retaking vitamins that seem healthy but are actually dangerous after age 60. Dangerous vitamins to avoid after 60. Number 1. Iron supplements. Iron supplements become particularly hazardous after age 60 because the body's ability to regulate iron absorption changes dramatically with age. Unlike younger adults who can efficiently eliminate excess iron, seniors often develop what doctors call iron overload syndrome. The body starts storing excess iron in vital organs, particularly the heart, liver, and pancreas. Cardiologists warn that iron buildup in heart tissue can lead to irregular heartbeats, heart failure, and even sudden cardiac events. Hepatologists have documented cases where iron accumulation causes liver scarring and dysfunction, conditions that are especially dangerous for seniors who may already have compromised liver function from medications or age-related changes. The pancreas is equally vulnerable, with excess iron potentially triggering diabetes or worsening existing blood sugar problems. Research from the American Journal of Clinical Nutrition shows that men over 60 and postmenopausal women have significantly higher rates of iron overload because they are no longer losing iron through monthly blood loss. Most concerning is that iron overload develops silently over months or years. Symptoms like fatigue, joint pain, and weakness are often dismissed as normal aging, allowing dangerous iron levels to build undetected. Blood tests reveal the truth, but by then, organ damage may have already occurred. Doctors emphasize that seniors should only take iron supplements when blood tests confirm iron deficiency, and even then, under strict medical supervision with regular monitoring. Number 2. High-dose vitamin E. High-dose vitamin E supplements pose serious bleeding risks that can be life-threatening for seniors, particularly those taking blood-thinning medications. Vitamin E acts as a natural blood thinner by interfering with vitamin K, which is essential for proper blood clotting. When seniors take vitamin E supplements exceeding 400 IU daily, they dramatically increase their risk of dangerous bleeding episodes. Emergency room physicians report cases of seniors experiencing internal bleeding, excessive bruising, and prolonged bleeding from minor cuts after taking high-dose vitamin E. The danger multiplies when combined with prescription blood thinners like warfarin, aspirin, or newer anticoagulants that many seniors take for heart conditions or stroke prevention. A study published in the Journal of the American Medical Association found that seniors taking vitamin E supplements had a 13% higher risk of heart failure, contradicting the popular belief that vitamin E protects the heart. Neurologists have documented cases of brain hemorrhages in elderly patients taking vitamin E supplements, particularly those with high blood pressure or a history of stroke. The supplement industry often markets vitamin E as an anti-aging miracle, but research consistently shows that high doses do more harm than good in seniors. Natural vitamin E from foods like nuts, seeds, and leafy greens provides adequate amounts without the bleeding risks associated with synthetic supplements. Geriatricians recommend that seniors avoid vitamin E supplements entirely unless specifically prescribed for a documented deficiency. The risk-to-benefit ratio simply doesn't favor supplementation in this age group, especially when safer alternatives exist through proper nutrition and medical monitoring. Number 3. Beta-Carotene supplements. Beta-Carotene supplements carry hidden dangers for seniors that many don't realize until it's too late. Large-scale studies have revealed alarming connections between beta-carotene supplementation and increased cancer risk in older adults. The alpha-tocopherol, beta-carotene cancer prevention study followed 29,000 male smokers and found that those taking beta-carotene supplements had an 18% higher rate of lung cancer. Even more concerning, the carotene and retinol efficacy trial was stopped early when researchers discovered that beta-carotene supplements increased lung cancer risk by 46% in participants who smoked or had been exposed to asbestos. These findings sent shockwaves through the medical community because beta-carotene was widely believed to prevent cancer. Pulmonologists now warn that seniors, especially former smokers, should never take beta-carotene supplements. The risk remains elevated even years after quitting smoking because lung tissue retains damage that beta-carotene supplements can worsen. Additionally, beta-carotene supplements interfere with the absorption of other crucial carotenoids, like lutein and zeaxanthin, which protect eye health in seniors. Ophthalmologists have observed that patients taking beta-carotene supplements often have lower levels of these protective compounds, potentially accelerating age-related macular degeneration. The supplement form of beta-carotene behaves differently in the body compared to natural beta-carotene from colorful fruits and vegetables. Natural sources provide a complex mix of carotenoids that work together safely. While isolated supplements can create dangerous imbalances, oncologists emphasize that seniors should obtain beta-carotene exclusively from food sources like carrots, sweet potatoes, and leafy greens, where it works synergistically with other protective compounds without increasing cancer risk. Number 4. Megadose vitamin A. Megadose vitamin A. Supplements pose severe toxicity risks for seniors whose aging bodies struggle to process and eliminate excess amounts. Unlike water-soluble vitamins that the body can easily excrete, vitamin A is fat-soluble and accumulates in tissues, particularly the liver. Hepatologists report increasing cases of vitamin A toxicity in seniors taking supplements exceeding 10,000 IU daily. The aging liver becomes less efficient at processing vitamin A, leading to dangerous buildup that can cause liver damage, jaundice, and even liver failure in severe cases. Orthopedic specialists have documented that excess vitamin A actually weakens bones by interfering with vitamin D metabolism and increasing calcium excretion. This is particularly dangerous for seniors already at risk for osteoporosis and fractures. Studies show that seniors with high vitamin A levels have 40% more hip fractures than those with normal levels. The symptoms of vitamin A toxicity often mimic other age-related conditions, making diagnosis challenging. Seniors may experience dizziness, nausea, headaches, and skin problems that doctors initially attribute to other causes. Neurologists have observed that vitamin A toxicity can cause increased intracranial pressure, leading to severe headaches and vision changes that can be permanent if not caught early. Drug interactions present another serious concern, as vitamin A supplements can enhance the effects of blood thinners and interact dangerously with medications for osteoporosis. Geriatricians emphasize that seniors can easily meet their vitamin A needs through foods like liver, fish, eggs, and colorful vegetables without risking toxicity. The upper safe limit for vitamin A decreases with age, making supplementation particularly risky for those over 60 who may unknowingly exceed safe levels. Essential vitamins you must take daily after 60. Number 1. Vitamin D3. Vitamin D3 stands as the most critical supplement for seniors, with deficiency rates reaching epidemic proportions among those over 60. Age-related changes dramatically reduce the skin's ability to synthesize vitamin D from sunlight, with seniors producing only 25% of the vitamin D that younger adults can make from the same sun exposure. Endocrinologists explain that vitamin D deficiency creates a cascade of health problems that accelerate aging and increase mortality risk. Bone health depends entirely on adequate vitamin D levels, as the vitamin enables calcium absorption in the intestines. Without sufficient vitamin D3, seniors can consume all the calcium they want, but their bodies cannot use it effectively. Orthopedic surgeons report that seniors with vitamin D deficiency have 3 times higher rates of hip fractures, which often mark the beginning of serious health decline in elderly patients. Beyond bone health, vitamin D3 regulates immune function, with deficient seniors experiencing more frequent infections, slower wound healing, and increased susceptibility to respiratory illnesses. Cardiologists have discovered that vitamin D deficiency contributes to high blood pressure, heart disease, and stroke risk in seniors. The vitamin helps regulate the renin-angiotensin system that controls blood pressure, and deficient seniors often struggle with hypertension despite medication. Neurologists are studying connections between vitamin D deficiency and cognitive decline, with some research suggesting that adequate levels may help prevent dementia and depression in seniors. Most seniors need 1,000 to 2,000 IU of vitamin D3 daily, significantly higher than younger adults. Blood testing should guide dosing, with optimal levels between 30 to 50 ng per milliliter. Unlike vitamin D2, Vitamin D3 is the form the body produces naturally and uses most effectively. Number 2, vitamin B12. Vitamin B12 deficiency represents a silent crisis among seniors that doctors often overlook because symptoms mimic normal aging. After age 60, up to 30% of seniors develop atrophic gastritis, a condition that reduces stomach acid production needed to absorb vitamin B12 from food. This creates a perfect storm, where seniors eating B12-rich foods still become deficient because their bodies cannot extract and absorb the vitamin properly. Neurologists warn that B12 deficiency causes irreversible nerve damage if left untreated, starting with tingling in hands and feet and progressing to balance problems, memory loss, and cognitive decline. Many families watch their loved ones struggle with what they believe is dementia, not realizing that B12 deficiency is causing the symptoms. Hematologists see seniors with B12 deficiency developing a specific type of anemia that causes extreme fatigue, weakness, and shortness of breath. These patients often receive iron supplements that don't help because the underlying problem is B12, not iron deficiency. Psychiatrists have documented that B12 deficiency can cause depression, anxiety, and mood changes in seniors, symptoms that are frequently attributed to age-related mental health issues rather than nutritional deficiency. The most tragic aspect is that B12 deficiency is completely preventable and treatable, but only if recognized early. Blood tests can detect deficiency, but doctors must specifically order B12 levels as they're not included in routine blood work. Number 3, magnesium. Magnesium deficiency affects up to 80% of seniors. Yet it remains one of the most underdiagnosed nutritional deficiencies in older adults. Age-related changes in kidney function, medication use, and dietary patterns conspire to create magnesium depletion that undermines multiple body systems. Cardiologists emphasize that magnesium is essential for proper heart rhythm, with deficiency causing dangerous arrhythmias, palpitations, and increased risk of sudden cardiac death. Seniors taking diuretics for blood pressure or heart conditions lose even more magnesium through increased urination, creating a dangerous cycle of depletion. Sleep specialists have discovered that magnesium deficiency is a primary cause of insomnia in seniors, as the mineral regulates GABA receptors that promote relaxation and sleep. Many seniors struggle with sleep problems that doctors treat with medications, when magnesium supplementation might provide a safer, more effective solution. Endocrinologists have found that magnesium deficiency worsens insulin resistance and blood sugar control, making diabetes management more difficult for seniors. The mineral is required for over 300 enzymatic reactions in the body, including those that regulate blood pressure, with deficient seniors often experiencing hypertension that's resistant to medication. Orthopedic specialists note that magnesium works synergistically with calcium and vitamin D for bone health, and deficiency can contribute to osteoporosis even when calcium intake is adequate. Neurologists have observed that magnesium deficiency can cause muscle cramps, restless leg syndrome, and even seizures in severe cases. Most seniors need 320 to 420 milligrams of magnesium daily, but absorption decreases with age. Magnesium glycinate, or magnesium citrate, are better absorbed than magnesium oxide, which can cause digestive upset. Blood tests for magnesium are notoriously unreliable, because the body maintains normal blood levels by pulling magnesium from bones and muscles, masking deficiency. Number 4, omega 3 fatty acids. Omega-3 fatty acids represent the most scientifically validated supplement for cognitive protection and heart health in seniors, with research consistently showing benefits that extend both health span and lifespan. Cardiologists emphasize that omega-3 salts provide comprehensive cardiovascular protection by reducing inflammation, lowering triglycerides, stabilizing heart rhythm, and preventing dangerous blood clots. The landmark GISS-I Prevenzione study followed 11,000 heart attack survivors and found that those taking omega-3 supplements had 20% fewer cardiac deaths and 45% fewer sudden cardiac deaths. Neurologists are particularly excited about omega-3 salts' ability to protect brain function and potentially prevent cognitive decline. DHA, one of the primary omega-3 fatty acids, makes up 25% of brain tissue and is essential for maintaining neural connections and reducing brain inflammation. Studies show that seniors with higher omega-3 blood levels have larger brain volumes and better cognitive test scores than those with low levels. Rheumatologists have documented that omega-3 South reduce joint inflammation and stiffness, helping seniors maintain mobility and independence. The anti-inflammatory effects extend throughout the body, potentially reducing risk of cancer, autoimmune diseases, and age-related chronic conditions. Ophthalmologists recommend omega-3 South for protecting against age-related macular degeneration, the leading cause of blindness in seniors. Research suggests that adequate omega-3 intake can reduce the risk of advanced macular degeneration by up to 38%. Most seniors need 1,000 to 2,000 milligrams of combined EPA and DHA daily, the two most important omega-3 fatty acids. Fish oil supplements provide concentrated amounts, but seniors should choose products that are third-party tested for purity and potency. Algae-based omega-3s South offer a vegetarian alternative that provides the same benefits as fish oil without concerns about mercury or other contaminants. These 8 vitamins can literally mean the difference between healthy aging and dangerous health complications. Avoid iron supplements, high-dose vitamin E, beta-carotene supplements, and megadose vitamin A at all costs. Instead, prioritize vitamin D3, vitamin B12, magnesium, and omega-3 fatty acids daily. Before making any supplement changes, consult your doctor for blood tests and personalized guidance based on your medications and health conditions. Your safety comes first, always. Your health journey matters deeply, and making the right choices about vitamins can add years to your life. If this information helps you stay safer and healthier, please subscribe and ring that notification bell, because there's so much more vital health information coming your way. Your well-being is worth that small click.